Welcome clinicians. Today I'm breaking down the key parameters of cardiopulmonary exercise testing or CPT. CPET is a goldmine of diagnostic information. Understanding its parameters can significantly improve patient outcomes. So let's dive in. First up, peak VO2. This is the maximum amount of oxygen a patient can use during intense exercise. Normal values usually exceed 85% of predicted based on age, gender, and fitness level. Lower values could indicate cardiovascular, pulmonary, or muscular limitations. Anaerobic threshold, or AT, is next. It's the exercise intensity at which lactate starts to accumulate in the blood. Clinically, a normal AT is around 40 to 60% of peak VO2. A lower AT may point towards deconditioning, cardiovascular disease, or metabolic disorders. Now let's talk about the VE/VCO2 slope. This measures ventilatory efficiency. A slope above 34 can indicate heart failure, pulmonary hypertension, or other inefficiencies in gas exchange. Respiratory exchange ratio, or RER, is crucial. It's the ratio of CO2 production to O2 consumption. Values greater than 1.1 indicate maximal effort, while lower values might suggest suboptimal effort or possible metabolic issues. Heart rate reserve, abbreviated as HR reserve, is the difference between maximum heart rate and resting heart rate. Clinically, a lower HR reserve can be a marker of chronotropic incompetence or deconditioning. Next, oxygen pulse. This is the amount of oxygen used by the body per heartbeat. Decreased values can indicate poor cardiac function or peripheral circulation issues. Breathing reserve is the difference between maximum voluntary ventilation and ventilation at peak exercise. A low breathing reserve usually signifies ventilatory limitation, often seen in obstructive or restrictive lung diseases. SpO2 desaturation refers to the drop in oxygen saturation during exercise. A significant drop, typically more than 4%, can indicate pulmonary issues such as interstitial lung disease or pulmonary vascular disease. Blood pressure response during exercise should be monitored closely. Normally, systolic BP rises while diastolic BP remains stable or decreases slightly. Abnormal responses can be signs of cardiovascular problems like ischemia or even autonomic dysfunction. ECG changes during CPET are critical. Look for arrhythmias, ST segment changes, or conduction abnormalities. These findings can be indicative of ischemic heart disease or other cardiac pathologies. Finally, lactate threshold. This is the exercise intensity at which lactate begins to accumulate in the blood. It typically occurs at 50 to 70% of VO2 max. A lower threshold can indicate metabolic inefficiencies or early onset fatigue. To sum it up, interpreting CPET values in clinical practice helps identify and differentiate between cardiac, pulmonary, metabolic, or deconditioning-related conditions. When you're looking at these parameters, always consider the holistic picture of the patient. Thank you for joining me today. I hope this breakdown helps you unlock the potential of CPET in your practice. Stay tuned for more tutorials and clinical insights. Until next time, keep learning and stay curious.